Hello, Mr. J. I'm Anjanette. Nice
Hi.
to meet you today.
Nice to meet you.
So I am a registered nurse and I work closely with Dr. Davis. So you and I are meeting briefly today, and then Dr. Davis is going to come in and talk to you about your upcoming surgery, okay?
Okay.
I am your nurse navigator, and what my role here is to assist patients in navigating through what can sometimes be a somewhat confusing process, going to all the appointments, getting lab work, going through various procedures. When someone is first diagnosed with colorectal cancer, there seems to be a lot of people involved, and sometimes you can find that there's several providers that are involved in your care at the same time. And I will be there to ensure that we are all communicating with each other to provide you with very personalized and seamless care, okay?
Okay.
So I am here to be a resource for you and for any questions that you may have or that you may have forgotten to ask your doctor. I can also get information for you regarding any resources that you and I may find that could be beneficial to you as well. So here's my card.
Thank you.
I am going to be contacting you periodically, but I wanted to make sure that you had my number to call as well if you needed to. So before we get started, I would like to review some things I noted in your electronic medical record. Can you first start by telling me how old you are?
I'm 72.
Okay. So it also looks like that you have a diagnosis of high blood pressure and that you take medication, atenolol, 25 milligrams every day for this. You do also have high cholesterol and take Lipitor 80 milligrams per day as well. Is that right?
Yes.
Okay. So you take baby aspirin 81 milligrams a day?
Yes.
And how about any vitamins or herbal supplements?
I take a multivitamin when I can remember. Sometimes vitamin E,
Okay.
but no herbals.
Okay. So you also have arthritis, but you don't. You're not prescribed anything for this. Do you take anything?
Motrin sometimes, but not very often.
Okay. And it looks like you also were recently fitted with a hearing aid.
Yes, in my left ear, and I can hear so much better now.
Perfect. I also saw that you had a recent eye exam done at the eye clinic, and all of that looked really good. Looked like maybe you had some mild cataracts, but no glaucoma, and you only need glasses for reading.
That's right.
Okay. Any issues with urination, burning, urgency, frequency, blood in your urine, frequently urinating in the middle of the night, anything like that?
No.
Okay, great. Any issues with any decreased or smell or taste?
No.
Okay. Any issues with any memory loss issues or having any impaired judgment?
No, as a matter of fact, my primary physician's office did a screening a few months ago, and everything was great.
Okay. And any issues with feeling depressed or hopeless?
No, I'm saddened by this diagnosis and wish it hadn't happened, but I'm ready to fight this and get on with my life.
Sure. That's great. I'm actually really glad to hear that you feel that you can beat this. Older adults are unfortunately at a greater risk of getting depression, and especially older adults that have a diagnosis of cancer are even at a higher risk. So if at any time that changes for you, please don't hesitate and call me, and then you and I can determine if it's something that we need to do something about or if it just might be related to the situation and will pass.
Okay. Well,
so it looks like you are a retired firefighter.
I am.
And do you enjoy retirement?
Very much. It gives me time to do things I enjoy, like woodworking.
So do you have any financial concerns right now?
No, always wish we had more, but we're doing okay, and we have good insurance as well.
Right. That's good. Financial concerns can certainly add additional stress to what is already a stressful situation. You are married with 2 children?
Yes, and 4 grandchildren. It keeps us busy going to sporting events and dance recitals and such. We really enjoy that.
Awesome. Who else do you happen to socialize with?
We have a lot of friends. We get together and play cards and go to dinner. We're pretty active in our church as well.
That's great. Having a healthy relationships is important, and it sounds like between family and friends in your church, you have a really good support system.
I'm very fortunate.
You mentioned you are active in your church. Are there any specific religious or spiritual beliefs that I may need to be aware of, such as any healthcare practices or end-of-life care?
Nothing. Very good.
Okay. Have you happened to fill out any forms regarding advance directives?
No, but I have them, and my wife really wants me to get them filled out.
They are important, especially if something able to communicate, and they tell your wife and your family what your wishes are. It makes it easier for them to follow what you would want.
Okay, I'll get them done.
Okay. So Tell me about your diet. What types of foods do you typically eat?
I like steak.
Mm.
I like all kinds of red meat. I don't care for vegetables too much. I eat a few fruits now and then. I guess what I eat is probably too high in fat, but that's what makes it taste so good.
Absolutely. So, what about fluid intake? How many or how much would you say you're able to drink in a day?
3 to 4 glasses a day, probably.
Okay. Do you smoke?
Yes, I'm trying to quit, and my wife just hates it.
Okay. Do you drink alcohol? And if you do, how much?
Yeah, I do, but not as much as I used to. 4 to 6 drinks maybe a week, mainly around football games.
Okay. What about physical activity?
I lift weights twice a week, and I walk or swim 3 times a week. I don't do it for as long as I used to. It's mainly due to the fatigue. The doctor told me it's because of my blood loss is why I have the fatigue. But I had my knee replaced a few years ago, and the doctor told me it's important to keep it moving.
Okay. Sure, that's understandable. And that fatigue will actually get better after the surgery once the bleeding inside has been stopped and those red blood cells have had time to build back up and are able to carry more oxygen in your body. And that's going to give you some additional energy. As we age, our bone mass also declines and it can become actually easier to break. So by lifting weights, you actually are slowing that process and possibly preventing it. Physical activity such as walking or swimming is great. Your knee, but it's also important for the rest of your body. Your physician, due to some concerns with some blood that you noticed in your stool, you also had some fatigue, and it also looks like you had a 10-pound weight loss that occurred, but you were not trying to lose weight. Is that right?
Yes.
Okay. So it looks like you also then had a subsequent colonoscopy that revealed that you did indeed have colon cancer. They did a CT shortly after that actually revealed that there were no noticeable areas that the cancer had spread at that point.
Yes, that's correct.
Okay. So that is a lot to take in. So can you tell me about how you feel that you're doing today with all that information?
Yeah, I'm both angry and happy.
Okay, well, why don't you tell me a little bit more about that?
Well, I'm angry that I didn't get the follow-up colonoscopy when my doctor told me to, but I'm happy that it sounds like the surgery could cure that for me. I want to take better care of myself and my family. I'm looking forward to surgery so I can start taking care of the things I need to and get on with my life. I just don't know where to start first.
Sure. Well, I am glad that you said that. We cannot change the past, but we can actually change what we do in the future. I actually see some very specific things that I think you can do and have control over, and these will significantly reduce your risk in the future of having this cancer return, if you're interested.
Absolutely.
So, great. I'm first going to take a look and listen to you and do a really quick physical assessment, and then we'll go over all of that, okay?
Okay.
Okay. So, I've taken a look at your vital signs and that they took just a few minutes ago. And from looking at your chart, everything seems really normal for you. Your blood pressure and pulse are right where we would expect them to be with your medicine you're taking. I also saw that when you came down the hallway, and you look like you were ambulating just fine, and you do not use a cane or anything else. Is that correct?
Yes.
Okay, great. Well, I'm going to go ahead and take a quick look, and then we'll go from there. All right. So I'm going to start by just kind of taking a look at your head. I'm just looking at your face. I'm looking at your ears. I'm kind of feeling everything. Looks like you have good skin color, that kind of thing. Everything's all even. I'm also going to just take a quick listen to your lungs. I'm going to have you sit up just a little bit for me. Okay. Can you take a deep breath for me? And again. Okay. Now breathe normally for me. Okay, good. Go ahead and sit back. Now I'm going to take a quick listen to your heart. I am going to listen for a full minute. Sometimes that seems kind of like a long time, so just go to your happy place and just breathe normally for me, okay? Okay. All right. What I'm going to do also is I'm going to feel your belly. I want you to tell me, have you had any pain or discomfort in your belly at all?
No.
Okay. So I'm just going to feel around a little bit. If anything hurts or bothers you, I want you to tell me. Everything good?
Mm-hmm.
I'm also going to take a quick listen to your belly too. Okay. I'm going to hold your hand a little bit right now. I'm just actually going to hold your wrist. Just feeling for your pulse here. Just going to make sure that what I'm feeling is what I was hearing here. So, same thing. Perfect. All right. So looking at your skin, everything looks even. Notice that your hands are a little bit cool, a little bit pale. That's probably very much related to the anemia or the lack of oxygen kind of going around and why you're feeling fatigued. That will also get better after surgery. I'm going to have you go ahead and lift your legs up and put them on a chair for me. And just take a little look at your legs. And have you just sit like that. What I want you to do right now is grab my fingers. I want you to squeeze. Perfect. Keep your hands straight for me. I'm going to push against your, try not to let me push. And go this way. Good job. All right. So it looks like you don't have any swelling in your feet. You ever have any problems with that?
No.
Okay, good. So push against my hands. Don't let me push. Okay, and again, don't let me push. Awesome. All right, just go ahead and relax. I'm just feeling for your pulses here. And they're good. And skin color looks great. Go ahead and put your feet back on the ground for me. All right, two. Well, everything looks really good. So now let's talk about those things that we can work on. One of the most important things that you can do is to get those regular screenings. So this is important because you've had a diagnosis of colon cancer. That alone places you at a higher risk of getting it again. So in addition, the cancer tumors usually begin as very small polyps. They're slow growing, but they can turn into be precancerous and then actually turn into cancer. But they are typically so slow growing that by removing them when you get a colonoscopy is one of the most effective ways of prevention. Okay. So currently do have some current lifestyle choices that we can change that we can change so that this places you in a lower risk category.
Oh, great. What are they?
So the first one that I noticed would be smoking, would be the first one. You said that you were trying to quit, but since you are still trying, I would like to offer you some smoking cessation resources that I really think can help. They offer the patch at a really reduced cost to you and even counseling support if needed.
Great.
Okay, so I'm going to go ahead and give you that.
Thank you.
Diets that are low in fat, high in fiber, and low in red meats are recommended to decrease your risk of colorectal cancer. We have a great nutritionist that works with our patients, and she really has some great ideas that I think could help you actually add more vegetables into your diet so that you don't really notice them. We can actually increase your fiber by doing that. She also has some really great ideas on how to increase your fluid intake as well. She usually will meet with you once, and then we'll do some follow-up telephone visits and see how you're doing and if you need any additional support.
My wife will be very happy about that.
Okay. And then the next thing would be alcohol. Although you are not considered a heavy drinker, which would actually place you at even a higher risk, decreasing the amount that you drink is something that you might want to consider.
Okay, I'll cut down and just drink during the Bronco games, a couple, 3 beers.
Okay, I think that's a good deal. I think we're done. Do you have any questions for me?
No, I think you answered everything.
Okay, well, it was nice to meet you today, and you have my card. Don't hesitate to call if you think of something. Good luck to you in your surgery. Dr. Davis is wonderful. I will call you about a week after surgery and see how you're doing.
Okay, thank you.
Thank you. Good luck to you.
Thank you.